Despite the continuous steep rise in a number of cases, hundreds of Guyanese are still flouting national COVID-19 restrictions, which requires the mandatory use of face masks and limitation on social gatherings. Over the weekend, several videos and photographs surfaced which showcased a number of persons gathered at popular liming spots, many without face masks and definitely not practicing social distancing. National Emergency Medical Director Dr. Zulfikar Box is once again reiterating the call for Guyanese to protect themselves and others from the spread of the disease.
I continue to ask and plead with you to please, let's be responsible. As I've been saying, countries with and this is the evidence, countries with responsible citizens are doing far better with COVID than countries with irresponsible citizens. All we need to do as a country is cooperate and do the preventative measures. Once we do the preventative measures well, you make our lives easier here because we won't have that surge in COVID cases which can overwhelm the system and leads to a lot of loss of life. So what you can do for me is everybody, if as much as possible, stay home. If you don't have to go out, please don't go out.
Dr. Box, who is also the head of the Accident and Emergency Department at the Georgetown Public Hospital Corporation, GPHC, stated that it is especially emotionally and physically overwhelming for healthcare workers to deal with the COVID-19 patients. The medical practitioner reminisced on the difficulty initially experienced by local healthcare professionals when the country confirmed its first COVID-19 patient and subsequent death. He stated that 48 of his staff were exposed to patient zero.
We never knew about the disease. All of a sudden, you're exposed to such disease, and then you realize that you've exposed yourself, possible you've exposed your relatives, and then you had to go in quarantine. So it was difficult to manage my staff, motivate them, those who are in quarantine, and because of that, it caused a little challenge in terms of our staffing in the department, and there was a period of fear. We're all human beings. It was a period of fear when we weren't sure in every aspect of COVID management. So motivating staff was probably the biggest challenge.
The strain took a toll on the mental health of the 48 staff, as Box related that many were depressed. He noted that this has changed somewhat, with the same staff back in the field dealing with more COVID-19 patients currently. Another challenge relayed by Dr. Box initially was not having an effective system to ensure that COVID-19 patients were taken care of and that the medical staff were safe. According to Dr. Box, they have been able to implement an efficient system that caters to both COVID-19 patients as well as medical staff.
Tough question, because you ask me about achievements of COVID, and it's hard to quantify achievements when it comes to something like this, when it's a pandemic. We're losing lives. I mean, people are getting infected worldwide. It's caused a devastation. And for me to reflect at this point in terms of achievement will probably not be the most accurate depiction. What I can say is that the way the team has risen and responded to such a crisis in such a challenging situation currently in Guyana, for us all, I must say that by itself is an achievement, and I think it shows the resilience of human beings and healthcare workers.
For the HGP Nightly News, Amel Griffith.